I am from Old Dominion University. I have colleagues with me, and I'm going to talk to you about a telehealth program that we have implemented within an interprofessional program, because we believe that telehealth is a great kind of leveler for interprofessionalism, because each profession is going to need to learn how to communicate with each other, and they're not always going to be with one another. So what a perfect opportunity to instill telehealth. And I'm going to talk to you a little bit about etiquette, and that it's not intuitive. And as I listened to some of your research projects this morning, and you were talking about programs that worked and programs that didn't work, it kept kind of going round and round in my mind. Perhaps some of these programs aren't working because the providers that are using them can turn the equipment on, they know how to work the equipment, but they don't always know how to present themselves on the other side of the screen. So that's really the basis of the talk that we're going to do today. We all know we're a group of telehealth lovers, so it has certainly expanded globally. We don't need to argue that. We've listened to the meta-analysis and the research that's been done. We know that it's published. Unfortunately, however, when you go to the research with regards to education, there's not as much there. We're talking about the theory, we're talking about didactic, and most of the papers are discussing hands-on. They're not really talking about the human factors and the soft skills, or what I like to call the telehealth etiquette. So I'm going to tell you a little bit about our program. It's not quite as detailed as yours. I'm very impressed, and I can't wait to meet with you. So we have a program that lasts for 2 weeks, and we narrowed this down from 1 month initially to a 2-week experience, because I'll show you a slide in a minute. We have 4 universities now that are involved, and we have 10 professions. They can really only give you 2 weeks, because if you're in academics now, you know that all of the curriculums are jam-packed, and wedging anything else in is nearly impossible or difficult. So during the first week, the students asynchronously go online and they complete learning modules. The learning modules include interprofessional education, healthcare and finance, the importance of telehealth. What is telehealth? How to use telehealth. While they're embedded into this 1-week module, it is on a Blackboard format. And because they're various universities, we are using a little-known feature on Blackboard where various folks can come into a learning platform at the top. So they can be from 4 different universities and use this. During that week, once they've completed their modules, they are given a complicated case that they develop an interprofessional care plan for, with the patient being the center of the care plan. They're challenged throughout this care plan to think about technology, utilizing some of the learning modules that they've gone through. What type of telehealth could they embed, or Bluetooth, home monitoring? They then come onto campus on a Monday after they've done this 1 week of work, and they convene, and I'm going to walk you through what we do, but they convene for face-to-face interaction. So when they're doing their learning modules, we have purposely placed them into groups of 5 to 10 interprofessional members. So the teams are no larger than, 5 to 7. The teams are no larger than 7 professionals. When they get onto campus, they remain in that group. So they're forming their team dynamic. They then are taken through patient visits, and we are simulating a Cisco Jabber for their telehealth. They get to visit with a patient dyad face-to-face as a team, and then they visit with another patient dyad through the telehealth. We then have another section where they go into a room and they can touch the equipment. They can play with an AMD card. They can look at Bluetooth home monitoring equipment. They're challenged to think about mobile applications and how could they apply mobile applications to the patients that they visited. Throughout the day, we have a section in the middle where we reconvene and we talk about telehealth etiquette. And I'd like to share that we use your telehealth etiquette video. I was so impressed to meet you today. So they see a very bad telehealth visit, and we talk about what's wrong with it. Had they ever considered their clothes choices and things of that nature? And then the second week, they are all virtual. Mind you, they're 4 universities. So virtually, these students are then challenged to develop a website that addresses the needs of one of the patient dyads that they had met that day. So Anyone in here ever created a website? Not a lot of you. If I told you today that you needed to go home and in a week with a team of 6 people develop a website to meet the needs of one of the patients that you cared for that day, would you look at me like I was crazy? They look at us like we're crazy, and you would not believe the beautiful websites that they develop within that week. And then they present that website to us following the week via WebEx. So again, they're using a virtual platform to present what they've done. Whoa, and that is not what I wanted to do. There we go. So we are collecting data, as this is a research symposium. I'm sure you'd like to know, what are we collecting? We have developed a telehealth etiquette instrument. It's researcher developed. We are looking at pre and post data. So the students take this survey prior to coming on campus. So they've already had some of their online learning module, and before they come, they have to complete these surveys. And the etiquette, I'll show you in a minute the questions. It's an 11-item questionnaire. And then following the day experience, we survey them again to see whether their perception of telehealth etiquette has changed. We also use the mirrors. When the students are on campus during these standardized patient experiences, are you familiar with standardized patients? They're fabulous, they're patient actors, they are amazing, and I'll tell you how amazing they are. One of our student groups are clinical counselors that had, prior to this experience, had never used standardized patients. And when there was a break in one of the visits, the standardized patients kind of dropped their acting and started chatting with one another. And the student looked at me and said, "I think we fixed them. Look, they're happy now." And I'm like, oh. They're patient actors. So at the end of each experience, kind of along with your theory and learning, the standardized patients then come in and evaluate the students and give them real-time feedback. You did this well, you didn't do that well, and they're using the mirrors to evaluate that. I am really not, there you go. So let me tell you a little bit about our student demographics. So we do look at their age, realizing that most of these students are digital natives. So if you see that they're digital natives, intuitively you would think they would transition quickly to telehealth. They don't. They text, they FaceTime, but they have a very difficult time transitioning that casual form of conversation over to a professional visit. We've got listed up here 7 of our professions that we have the data collected on. We have our athletic training, they are master's level students. Communication disorders are speech and language, they are master's level students. Dental hygiene are bachelor level students. Our medical students are 4th year. Mental health counseling are both master's and PhD level students. And then our nursing students come in at both the master's level and the doctorate level. I'd like to tell you some of our other professions that we don't have the data collected on. We actually do have the data collected but not analyzed yet. We have social work students from an undergraduate program in another university. We've got, who else is not included up here? Help me, team. We have PharmD. We have PharmD from another university. We have physical therapy from our own university. We have, who else am I missing? There's like that's it. And we have our own university, Old Dominion. We have Eastern Virginia Medical School. We have Virginia Wesleyan, where our social work students are coming from. And we have Hampton University, where our PharmD students are coming from. So how did we recruit them? We just talked about our program. They knew they needed to integrate interprofessional training into their curriculum. Little did they know they were also getting telehealth, so they came to join us. We have 170 students that have completed the rotation, and I am hoping by the end of the summer we'll have probably 200 pre and post that we can report on. This is how the students rated their experience coming in to this one-day workshop. 42 said that they had had absolutely no telehealth experience. It's fascinating because we work near the Centera complex and they do use telehealth. But these medical students have not been exposed to telehealth in their practice. We have 11 that said that they had had some experience, and we have 2 that said they had had experience in the last 7 to 12 years. I'd like to know who they were. And then we ask about just their level of experience with technology, and you can see that most of them feel that they have quite a bit of experience. This is our etiquette tool. So what we ask them, these are not the full question, but basically, do they think that they need to follow telehealth rules? Okay, so this is our pre and our post, and you can see that there's a significant improvement after a one-day experience. We ask if they think they should follow HIPAA guidelines. This is on a Likert scale of 1 to 5. 2.98 think that they really are not that worried about it. Appropriate clothing, that's the big one that they usually will look at you and say, what do you mean appropriate clothing? So we're talking stripes and flashy clothes. This is a team of students that are doing this telehealth visit with a patient that is distant. So they're 5 to 6 students sitting in front of the camera. They don't always put themselves in front of the camera. So that's that question. Do they need to control for background noise? Do they have computer skills? Do they think they need to practice the equipment ahead of time? A lot of them don't think they need to practice that. Do they need to ask whether their client is comfortable? Is the practitioner proficient in is it important that the practitioner is proficient in telehealth? Do they think that this visit is going to resemble a face-to-face visit? A traditional in-person face-to-face visit, and is it important to start on time? So that is our survey. And then these are the questions that, if you're familiar with the MIRS was done originally, I think, in Arizona, and then through EVMS, and it is a long tool that they use for the standardized patient evaluation and feedback. We've taken sections out of it that fit the telehealth visit. So did they elicit the full spectrum of concerns of the patient? Did they encourage the patient to talk? Did they use open-ended questions with their interviewing? Did they facilitate techniques for communication? Did they determine the patient's understanding? Did they get the patient's perspective? Did they achieve a shared plan goal? Did they summarize? And did they assure future plans? Another part of this that we don't have up here and we've got beginning data on is also their ability to display empathy. And I'm going to talk to you about that in just a second. So these are the behaviors that we typically observe in the students. We have negative behaviors and we have positive behaviors. The negatives, let's talk about them first because they're more fun. As they're standing there, as they're sitting there visiting with this patient, they're doing things that I would argue they would never do in a regular visit. They have sidebar conversations with one another. They do a lot of finger and tapping of the pens, which are very distracting on the other end, that they might do in an office that is not as magnified on a telehealth visit. They will laugh with one another, and these patients that they see are very complicated with complicated issues that are a little uncomfortable, and when they start giving their history, they'll like chuckle with each other about, oh, and forget that they can be seen. There's drinking, there's chewing of gum. They will have a disinterested appearance. And that disinterested appearance is just kind of looking like this. And the SPs on the other side give the feedback that that flat affect comes across as disinterested, not listening. There are long periods of silence that are awkward, that may not be awkward in a traditional visit. And they tend to get really disorganized with their interview. It loses the beginning, middle, and end. So I think it's more fun for the, I'm being told to hurry up, to go more with the negative behaviors. The empathy is fascinating. The students don't think that they can display empathy. By and large, they will tell you, I can't tell you how many turn around and look at me and say, empathy? Through telehealth, I can't touch them. I can't do empathy. But they can. We all know they can. But they need to be taught how to do that. They need to use their word choices more. They need to think about what they're saying. They need to pace themselves. They can lean into the camera. They can look in the camera. the standardized patients will come back in and give them the feedback that, yes, you did. You know, if the student actually conducted a good visit, they will not think that they've displayed empathy, and they get the feedback that, but you did. You were looking at me. Your word choices were right. And they will say, but I wanted to touch you. You know, so they really struggle with not being able to do that typical touch that they have in a visit. So these are some of the student comments, and I could talk to you for another hour about this, but I can't. They think, we've heard several times from them that the telehealth monitor is the elephant in the room. They have a hard time just doing their visit because the screen is there. They will tell you again, I want to touch my patient. I can't display empathy. I don't even understand how I can begin to display empathy in this visit. They do say, along with what you talked about earlier, that it gets easier. The more they do it, the easier it gets. I didn't have time to share with you the way we do these visits, but they are given 15 minutes of a patient overview that they sit as a group and they read the case. We time them and we don't say anything. And then we say, okay, it's time to go. They turn the monitor on and they have a 15-minute visit as a team. We stop it after 15 minutes. They get 15 minutes to talk amongst themselves, not with us, what they did well, what they didn't do well. They go back for the final 15 minutes, same visit, wrap it up, feel a little bit better about how they did it. It ends after 15 minutes, then the standardized patient immediately comes in and gives them feedback off their mirrors. So they get immediate feedback. So as they sit here, I'm glad we had that chance to break, because honestly, during the first 15 minutes, sometimes it's a train wreck. And it's hard to sit there as a facilitator and not say anything. And that's what we've decided as faculty, is it's their team building, it's their experiential learning, it's not me, it's them. So imagine sitting there watching them fail miserably. And then pull it together very quickly during the second round. So in conclusion, students can learn telehealth etiquette quickly. They can learn it in a day. You can change perception, you can change behavior in a day. But remember that without that education and that practice and that immediate feedback, they often forget things that they're good at, and they do all the time. They forget to educate. They forget the structure of a visit, beginning, middle, end. They forget to elicit the patient's perspective. They're so worried about the screen that the monitor is going to become the block. And again, they overwhelmingly don't think they can display empathy. So what are we going to do? I mean, telehealth etiquette application is not intuitive. I would argue that it's not intuitive. That students and providers, as you said, we need specific training. It is not enough to say, look at this beautiful piece of equipment that's going to make lots of changes for your patient, and this is who's going to keep your IT backed up, and this is how you turn it on. Have fun. You know, it doesn't work that way. We need to train them. Even in a day, you can train them. A little bit of work goes a long way. Previously developed professional skills, these are fourth-year medical students, and we do this every month, all year long. So we see fourth-year medical students that are graduating in 2 months. Do they not know how to conduct a professional interview? They do. I would argue that they do. But when you turn that telehealth screen on them, they don't. And we need to focus is placed, as I said, on the technology rather than the human factors and the visit. So what we would like to do is replicate this with practicing providers to see if physicians and advanced practice nurses that are in the field and have been in the field for years have the same problem, and if we can educate them maybe even a little faster than what we do with our students. We also are having a hard time, as we all know with research, of getting our students pre and post data, and that's why we don't have the high numbers that we have. So as our numbers go up, we'll have better pre and post data, and we're hoping to have that in the next year because we run this every month, and we have about 40 students that run through each of our courses. We are going to look at our etiquette tool this summer. We're going to run some validity and reliability testing, and we'd like to have that published by beginning of the fall and make it available, and I'd love to collaborate with other people that are teaching. And we're also going to look at the adapted mirrors, taking out those sections, again running reliability and validity testing to make sure that it really does work with a telehealth encounter, and doing some inter-rater reliability as well to see if these standardized patients have inter-rater reliability when it's a telehealth visit. We know they have it when it's a traditional face-to-face visit with this tool. And that is, I'm sorry I went over.